This is Impact Healthcare, people and strategies that are disrupting the health benefits industry. And now, here's your host, healthcare benefits industry expert and the originator of the transparent health benefits movement, Lester Morales.
Man, welcome to another episode of the Impact Healthcare podcast. I am your host, Lester Morales, and I have a very interesting guest. We talk about Impact Healthcare, the podcast, as the people and the strategies that are changing health benefits. And this is a person who is, let's call it, sat on both sides of the desk. On the one side of the desk, they were seeing all of the craziness that happens. And I'm sure you're going to get to hear the story on why that started the fuel of where he is today. Dean, for our audience members that don't know who you are and who your great company is, give us an introduction.
Happy to. Thanks for having me, Lester. So I'm the CEO of Fair Market Health. Fair Market Health is an online marketplace for healthcare services. And one of the things that we do at Fair Market Health, or strive to do, is make healthcare purchasing more transparent and more convenient. As a lot of, I'm sure your guests know, healthcare is a very complex thing. So we try to take something that's complex and make it more consumer friendly. And then healthcare, as many of your guests also know, is not generally speaking wholly transparent. And so, especially as it relates to pricing. And so we try to solve that little problem as well, again, using primarily technology in an online marketplace to do that.
So Dean, you said two words and you just kind of scutterbugged. They're huge words. You said transparency and convenient, which couldn't go further away from how the normal healthcare world works today. I kind of want to start and rewind and says, you've been a CFO. You were sitting on that side of the desk. I'm assuming back then, maybe it wasn't your second or third largest expense like it is in most scenarios today, but it was still a top, expense. Talk to us about that experience and maybe other CFOs and employers in general that are listening to this can really resonate with where you were feeling. And if that had anything to do with getting into what you're doing today, talk to me about that bridge.
Yeah, you bet. You bet. Well, so I've been a CFO at various companies across various industries, and I've seen kind of all of the ways, or many of the ways, that businesses handle employee health benefits. One model, and this is one I have personally lived and seen in many other instances, is the business kind of hands the employee benefits responsibility off to their HR department, and the finance person, the legal person, the analyst, the risk management team, that all do exist in the business, right? Because the other parts of the business involve all of those very important capabilities. But a lot of businesses, and I'm not going to overanalyze it, but a lot of businesses just look at health benefits and they say, well, this is people related. That must belong in HR. So off it goes to HR. And as you know, and all your guests know, HR's got a lot on their plate. They have a lot on their plate. Compliance, all the people issues, recruiting, retention, all those things land in their area of responsibility. And then here comes this big thing called employee health benefits that gets added to their plate. That's a big challenge for most HR departments, especially if you're a small or medium-sized employer, because in most of those businesses, you can be a one-man band, a two-man band, a three, you're a small team sometimes, and that is a big area of responsibility. I've seen that done, and I continue to see that done in clients that we work with. Another model on the other end of the spectrum is the businesses really do treat health benefits almost as a standalone business unit, right? And so they bring all the capability that exists in all of their other businesses to bear on their health benefits, quote unquote, business. So they bring the finance capability, the accounting ability, the HR ability, the analysis capability, the risk management capability. They bring people with appropriate expertise, and if they don't have it inside the company, they make sure they're pulling in that expertise from outside the company, whether that's an advisor who's got benefits, knowledge and experience and capability, or maybe it's a very specialty capability like a PBM expert who can come in and advise the company. So they very much treat it like a standalone business unit and bring all the appropriate expertise and capability to bear. And then there's kind of a model that's kind of in between, right? It's mostly the responsibility of HR, and they can tap on someone's shoulder for appropriate expertise kind of when they need it, but it's not really managed with the high intensity and high in focus like a typical business unit is managed.
So Dean, and I don't want to lead the horse to water, lead the witness if we were, in the court of law. But my guess, and this is not prepped, you and I didn't talk about this.
That's right.
My guess is that as you go from the hands off to the hands on approach, results also get better with that. Is that a fair assumption?
100%, and I'd say really without exception, at least as far as I've seen in my experience, both working inside businesses and now working outside businesses and advising and helping businesses, I've seen no exception to that. Those that really do go hands-on with their health benefit plan, and again, that means bringing all the appropriate capability and resource to bear in terms of bringing solutions. Those are the benefit plans that see the best results. And again, that's not a knock on those small businesses who's delegated the HR response or the benefits responsibility to HR. What I found is those HR leaders really want the model to look more like the one that we're describing, that's more hands-on. It's more of a team or committee approach. But again, they haven't evolved their way to that kind of a model.
So Dean, in whichever model, talk to me about maybe your top two things that you have learned from the rolling up your sleeves, getting dirty, that maybe are misconceptions that are out there, or myths, or things that you're like, I wish the younger version of Dean, when he was, getting ready for this, would have known. That might be suggestions for some of our listeners. What are some things that you're like, man, I wish I knew that before? Yeah,
well, and you're talking to a former or reformed finance guy, so it probably won't surprise you to hear this, but I really do think it's true. Data really does matter. Data does inform decisions. And again, businesses use data to manage every other part of their business. But again, for some reason in healthcare, we haven't really embraced the idea that the data tells a story, and are you using the data to understand what story it is telling you? Now, a lot of the reason data hasn't been used to the company's advantage or the health plan's advantage is it's hard to get to, right? There's a lot of vendor situations that they're kind of working against you in terms of giving you access to data, but you can break through that. You have to proactively engage to figure out how to get the data, how to scrub the data, how to analyze the data. But again, those problems have all been solved in other parts of the business, and it's worth solving in the healthcare space.
So data matters is one. Give me another one.
Well, I would say, vendor relationships matter a lot. Alignment of vendors and philosophies and incentives very much matter. And again, it's true in every other part of a business's life, right? They care a lot about who their parts supplier is, and in every other part of their business, they want to make sure that they and their vendors are aligned on mission, vision, strategy, all of it. And I don't think we bring that thinking to the health benefits space, right? We kind of take the easy and the obvious option, maybe more than we should. And the truth is, there are vendors who are very much working for themselves, counter to the company and the employee plan members. And there are companies who vendors, that is, try to align themselves with what objectives the plan and the company is after. And you got to pay attention to that.
And it is such an interesting thing, being obviously students of the business, things like what clients call premium, health insurance companies call revenue, right? Like such an obvious statement for us in the business, but very rarely when I have a conversation with CFOs or in HR, do they think about it like, do you wake up in the morning wanting to lower your revenues? Like, why would you think anybody else does? And then we sit here and we're surprised why, decade after decade after decade, we have double-digit rate increases, right? It's just such an interesting thing. Yep. I want to draw the bridge. I want to climb over the bridge. So you're sitting on that side of the desk. You're managing companies. From the financial aspects, you're seeing this lacking in transparency and lacking in ease and efficiencies, let's call it. There's a bridge there that gets you from there to, starting a business that is tech driven and that is all about transparency and ease. Talk to me about that bridge.
Yeah, well, mine is, again, as you suspected, a very personal story. I was actually helping as an advisor to Fair Market Health. I was working in my corporate finance job, and I was actually helping as a board member advisor to Fair Market Health. And I liked what they were doing. I liked the philosophy. It's very free market. I'm a free market guy. So I was very bought into the mission and vision of Fair Market Health, but had no plans of ever coming to work inside the business. I was very happy with my corporate role and responsibilities. But what changed for me was a friend of mine actually used Fair Market Health. His wife needed a hysterectomy. And for long story I won't go into, they ended up kind of being in between insurance. So they didn't technically have insurance coverage. And so he was trying to work with a healthcare provider to get his wife the hysterectomy that she needed. It wasn't exactly an emergency surgery, but it also wasn't a surgery that could be indefinitely put off. She needed to have it within a certain amount of time. And so he was working through the process, trying to engage with the healthcare system to get his wife the surgery she needed. And the provider that he was working with, which was a large local health system, they told him that it would be at least $50,000. And he responded to the provider and said, well, there's a lot of numbers above $50,000. Can you tell me which, give me a tighter range of what this surgery is going to cost? Is it above, there 100,000 is above 50 and 200,000 is above 50. Can you tell me more specifically what it would be? They said that they couldn't. So then he came to me. He was generally aware of Fair Market Health. And he said, hey, by the way, do you guys have hysterectomies on your website? And I said, yes, we do. And so I looked it up and he said, well, how much is it? And I don't remember the number exactly, but let's, for argument's sake, say it was $11,000. And he's like, well, hang on a second. Is that just the facility fee? Because that's what he was being quoted with, the 50 was just the facility fee. That didn't include the doctor or anesthesiologist or anything else. I said, no, that's the all-in number. That's the only price you'll pay. He's like, what am I missing? I mean, he's a smart guy. He's a business owner. He's like, come on, there's got to be a catch. I was like, there's absolutely no catch. You're going to go to an independent surgery center. You're going to have the surgery with one of the best OBGYNs in town. And oh, by the way, when he went to the appointment with the OBGYN, that doctor on an unsolicited basis started talking to him about how much he enjoyed the experience of working with Fair Market Health, because that doctor knew what he was going to be paid. He got to set his own price. He was going to be paid immediately with no insurance coding, billing, or collections effort. He loved it from his standpoint. And so as soon as I had this story relayed to me, I was like, okay, this is what I want to kind of devote the rest of my career and energy toward delivering to more people.
Man, the story resonates on my professional, right? This is what I do for a living. Personally, because I've had both of my parents experience cancer. And then just as somebody who just got off an airplane and reads the newspaper and sees stories about, the unfortunate crap that happens. I love the story because of the opportunity that it obviously brings for the future. It makes me mad that we're so far away from this being the norm. So let's dive into the solution. Obviously not a sales pitch for you, and I know you're not taking it that way, but I think the solution obviously drives so much of educational conversation on the cost and the quality of healthcare changes dramatically from point A to point B, but most people don't even know how to ask the question, where to get the information, although that same person wouldn't drive to the nearest auto dealership and just get into a car and put their keys in ignition and drive away and let them invoice them 3 weeks later. That seems asinine, but that's how everybody accesses healthcare. So talk to me about the solution and what it does. And I'd like it, to dig in that conversation as to like the value that it provides for the end results, being a member, an individual belly button, and that employer as well.
Yeah, well, and all of this, and I'm guessing most of your listeners do as well, but it is worth repeating daily for those who haven't yet heard it. Not only does price transparency deliver better outcomes, obviously in terms of cost, but changing that site of service, as you well know, not only lowers cost, but this is the part that really still blows my mind, is quality goes up with it, right? That's the part people assume that, oh, I pay less for healthcare, therefore I'm taking a hit on quality. And it's like, no, it's the exact opposite. It's crazy. Pay less and you get better care and outcomes, not only in terms of outcomes, but also in terms of patient satisfaction. Right. And so it's like this,
I want to dig into that because common sense, right? So let's go put you back in your CFO's position, right? Higher units equal lower unit costs. Somebody who does something over and over again, they do it faster, cheaper, stronger, right? I mean, it's just intuitively in every other aspect of our lives, we get it. Why do you think in healthcare that is such a big conundrum and big mountain to climb over? Is it just a lack of ever seeing enough supporting data to kind of hear it? Or why do you think so many people have that, hey, better healthcare actually is cheaper, for all the same reasons you would think in the economics class I passed in 9th grade?
Yeah, I wish I had a good answer to that. I have to admit, I don't. I mean, I do think a lot of people think about healthcare the same way they do about, luxury automobiles, right? It's kind of this idea that, well, the BMW costs more, and I can see it's got more features and higher finishes and quality. And so I think people just believe, well, that same analogy applies to healthcare, right? If it costs more, I have to be getting more. It's almost like they want to believe that's true, right? I mean, it's like they just convince themselves it's true.
So now you've got this, what you term marketplace, for people that might be struggling personifying what this looks like. Talk to me about the solution, how it's populated, how people use it, and let's dig into that.
Yeah, the way I typically describe it to people, because at this point, almost all of us have used an Airbnb platform. That's really what we are. We're matching buyers and sellers, and unlike Airbnb, that's matching homeowners that want to rent out their home with people who want a home to rent out. Ours is healthcare services. So we invite doctors onto the platform. There's no cost to list services on our platform. And that's a place where buyers, both both individual patients shopping for themselves or health plan members. When we work with a self-insured employer, they come to this marketplace and are able to shop for specific doctors that they may know or have a referral to. They can shop on price, they can shop on location, they can shop on specialty. It's got all the shopping and filtering services that we're very accustomed to using in a platform like an Amazon. And again, it's all transparent. You can see what is the all-in cost of the service, and you can know up front. I tell people all the time, even if you're not going to click the buy button, at least come on our website and browse around and get a sense for, hey, what would this cost if I was paying cash?
So let's go with the most popular radio station in the world, WIFM. What's in it for me? Let's take that triangle and say I am a consumer.
Yep.
I have been taught since an apple a day keeps the doctor away that this trusted bond between my doc and me, and they would never steer me in the wrong direction. My heart's of hearts, and I'm naturally like I'm Pollyanna and to the nth degree. I think most people are good in life,
right?
So I don't think anybody wakes up in the morning wanting to screw somebody else in this scenario. But why is this even? What's in it for me for that patient who says, I've been seeing Dr. Jones for 20 years. If Dr. Jones tells me to go over there, that's got to be the best option for me. Let's dig into that from the patient's perspective.
Yeah, no, and referral patterns really do matter. There's no question. I fall, I won't say victim to it, but when I go visit with my primary care surgeon and he refers me out to another facility or to another doctor, I'm inclined to trust that recommendation. Now, do I ask a bunch of questions of, well, what is it about this doctor versus the 10 other doctors that you could have chosen? Usually the answer is, well, I play golf with that doctor. I don't, as a person who studies healthcare and healthcare trends, I myself kind of fall victim to the just trust your primary care doctor and follow their advice and their referral. Now, I'll tell you a quick story. I actually did that once. I needed to get a CT scan. My doctor, primary care doctor, referred me out to a facility to get the CT scan. Now, I'm a trained guy that always wants to know what's the cash price for this. I called the CT facility that he recommended. I said, what's the cost? $1,300. Now, I had already looked on Fair Market Health and saw that same service available at a different facility for $800. So I asked the place I was referred by my doctor and said, well, what is it about your service that makes it worth $1,300 versus the $800 that I have as an option? I said, is your equipment better? Are your doctors better trained on how to read the image? Like why would I pay an extra $500? And the lady on the other end of the phone said, oh, there's no difference. It's the same equipment. It's the same radiologist service. I said, well, why would I pay $500? Don't you think I should just go the other place and pay $100? She says, that's what I'd do. I mean, so there is an opportunity to ask, train people, educate people, as you said, to ask more questions. But, we're a long way from being where we need to in terms of retraining people how to be effective consumers in the healthcare space. We're good at it in every other part of the economy, but for some reason in healthcare, we forget it.
You know what's interesting about that statement, and I'm so glad you said it. As advisors, and not guys like you and I, because we live swimming like a salmon, the wrong way, but like I spent 15 years of my career doing it the normal way. And let's say 98% of advisors and employers and everybody else are doing it the normal way. We're so far removed from that average consumer, right? Whether it's, HR is typically making a higher wage than the people they're making decisions right on their behalf. CFO, certainly us as brokers, we make way more money than any of us deserve, right? So you look at that, and that's the thing that drives me crazy is people are like, oh, that's a harder process.
Mm.
Right. And they go, or they won't understand it. It sounds more complex.
Right.
And then over here I go and I'm like, these people are cutting 39-cent coupons for lima beans on Sundays. And you don't think that one search on your site, one phone call to an advocate, like, you don't think that they would do that to save $500 in your example? $500 to somebody, it could be the difference of taking kids on vacation, buying them new books and new book bags for school that's going to start. Like, it's so bizarre that we're so far removed from that average consumer that we're like, they're probably not going to want to do that. That seems tougher.
Well, and the other thing I'd add to that, Lester, is because I hear that a lot as well. And you know what I always, because I hear, well, not everybody will do it. And I always accept that. Yeah, you're right. Not everybody will do it, but some people will. Some of your plan members actually will do it. And what we found is the few that do it will start talking, right? And before you know it, you're 2-3 years into this, and your employee group has figured out, whoa, there is a better way to engage with the healthcare system, and this is it.
It's such a, I almost want to like have like a fly swatter. And when somebody says not everyone's going to do it, if that was the case, we wouldn't do anything.
Exactly.
Let's keep serving pizza in the break room versus good food, because not everyone's going to eat the good food. I mean, it's like nothing would ever start. So the consumer has the opportunity to obviously get options, save money. Talk to me about, because a lot of times the that alignment of incentive, and we talked about that misalignment is normally the way of our business. That alignment between the plan, and in this conversation we're talking about the employer being the host, the plan sponsor, that alignment with the plan and the member. Talk to me about that magical piece, because quite honestly, again, if I could buy, back to our car buying experience, if I could buy the BMW for the Pinto price, of course I'm going to buy the BMW, right? But there's a reason we choose, what's more appropriate. Talk to me about that inner working of that conversation, that relationship.
Yeah, you bet. Well, as we've already said, incentives matter, and anyone who says they don't, I will argue to the death on that. Incentives absolutely matter. Most of our employer plan sponsors have implemented our solution, and there's others out there, creating an incentive for the employee. In fact, the way most of them implement it is they say, look, if you shop here, it is free to you as a member. And what they do is they don't take away the traditional health plan, right? If your plan uses Blue Cross or United or whatever, and if your member wants to keep slapping down that insurance card, okay, then deductibles apply, co-payments apply, co-insurance apply. It's the same old traditional health plan. However, if any of the members want to come shop on a transparent price platform that does have better pricing, the employers, at least in our experience, typically create an incentive for the employee. And the incentive typically is, this is free to you. You shop over here, because of the savings, we're able to pick up as the employer the whole cost. It costs you nothing. And man, does that drive incentive.
So Dean, I want you to travel back in time to your CFO seat. And I'm an advisor coming to have this conversation with you. And I tell you this exact conversation. Before you knew what you know now, you would probably be like, I'm unclear as to how giving away for free is actually going to save me money. Talk to your old self about the data that you see, even if there's some anecdotal examples you can give on. That's why the price difference is such a big place. Location matters. Yeah. That out-of-pocket expenditure being the incentive is not even a drop in the bucket. You're still going to save significant. Talk to your old self about that.
Yeah, and again, I'm a numbers guy, so this is a talk or a pitch I give frequently, because there's typically a finance person in the room when we're pitching a client. And the example I always give is a joint replacement. Let's say a knee, and in a place like the Midwest, that's a $40,000 to $50,000 procedure on average. It can be significantly more expensive based on which health system you end up engaging with, but on average, it lands, sometimes as low as 35, but on average, you're going to be in that $35,000 to $45,000 range. Well, on Fair Market Health, that price is $22,000. So, you've just chopped, call it $15,000 to $20,000 off the total price. And so what happens is the employer says, well, you know what? Instead of you having a deductible and a co-insurance, which results in, $10,000 of all-in expense, it basically makes them tap out their out-of-pocket max. We'll pick up the whole cost. We'll cover the 22. And in the end, and I can show this through the math, the employer ends up paying net less. And you have a very happy, and I would argue more loyal employee, because that's the other thing that we forget about traditional health insurance is all of that math happens in the background in a way that most people don't even really understand it or pay attention to it. And employers are paying a lot of money to subsidize their employees' healthcare, but your employees see little of that, which means you are getting very little goodwill from it, right? Because it's all happening in the background. What we help do is we actually help bring it forward, right? So when somebody engages on our platform, they see, oh, my employer is picking up this $22,000 bill on my behalf. Wow, I am very grateful for that.
Man, there's so many things I love about this. In that example, Dean, we've already talked about it. That 22,000 is all in, but that 40 or 50 could theoretically only be facility-based charges. Now you got to add on the anesthesia, the whatever. So now that 40 or 50 starts to turn into 50, 60,
Yep.
Or even more. You're not sending me to the cockroach motel who's giving me a bottle of tequila for my anesthesia. Like, these are typically specially, designed places, ambulatory surgery centers, orthopedic surgery centers, in that example, maybe. So
Yep.
Highly skilled places, highly skilled surgeons. I have two questions that are the automatic, like, not nerds like us, but just normal people would ask. Why would that doctor take less?
Right.
And then second, if this is true, why isn't Blue Cross, United, Cigna, Aetna, why aren't the normals doing this? Let's
Right.
address those two things.
Right. Well, great questions. The first question and answer is, in our model, the doctor doesn't typically take less, right? The savings is generated almost entirely from changing location of service. You're getting out of the high price, generally speaking, a high priced hospital / large healthcare system, and you're moving, as you said, to an independent ambulatory surgery center. That locational move alone is what generates most, if not all, of the savings that we're talking about. And as we said before, you also get, and this is empirically proven, better outcomes and higher patient satisfaction at those locations. In fact, the reality is most people would rather go to an independent surgery center than to a large hospital. I mean, it's just give people the choice. Would you rather go to that big building there that's got all kinds of sick and dying
Those
people,
things,
or would you
right?
rather go
Right.
here, and have an outpatient surgery? They'll take the outpatient surgery every day of the week. So it's actually the preferred choice almost all of the time. So that's the first thing, is doctors aren't actually being paid less. And in fact, you could argue they're being paid more, because we don't require a back-end billing department for the doctor to be paid. They perform the surgery, and within 24 to 48 hours, the money is in their bank account. They didn't need to do anything. They didn't need to jump through all these insurance hoops to be paid. So they don't need that back office billing department to allow them to get paid their money. The second question, which now I've forgotten.
If this is true, and
Oh, yeah.
you're not a whole bunch of hogwash, why isn't the Bucas of the world, the Blue Crosses, the normals, why wouldn't they be doing it? It seems logical. It says, well, wait a second, if they don't have to pay out as much in claims, they bring premium in, they don't pay as much as claims, they should be able to make some extra money. It's better for the patient. They care about the patient, at least their website says so. Like, why aren't they doing it?
Right. Well, I'll give you my answer, but you're actually the expert here. So you check me and tell me if I'm wrong. I mean, this is my supposition, and I think I'm right, but maybe you'll tell me I've left something out or got it completely wrong, which I'm open to. And again, a lot of people are aware, but some are not, that there's this little thing called medical loss ratio, and it's a mathematical formula that creates a disincentive for large carriers to lower the cost of healthcare. It actually creates an incentive for them to continually drive up the cost of healthcare, because it directly feeds their profit margin. And they're all public companies. They all have shareholders. They all are looking to increase their stock price. That's what public companies are designed to do. It's not their fault. That is the design of a public company. They are doing what they're supposed to be doing as fiduciaries of their shareholders. They're not fiduciaries of their employer clients. So they're, as you said at the beginning, they're working kind of against their clients in that regard. So I put it all in the category of MLR, and this idea that insurance companies and large health systems are sitting across the table and battling and negotiating to get the lowest price. It's all theater. It's all theater. It's absolutely not true.
Again, I don't think this one's up for debate. There's a lot of people that don't think about it, right? But if you cap the amount of money per dollar I can make in profit, how do I increase my profit? I went to public school, college, right? My degree's in risk management insurance, not math, but you charge more dollars. That's the only answer. That's literally the only answer. I would take it a step further and say, then, hey, why does a hospital have to charge, so much? And, the subtleties of what you're talking about from a strategic standpoint of time value of money, how long from service to getting paid. In your world, it's a couple of days. In that world, it's 60, 90, 120, 180 days. You got the insurance process and the number of people that need to touch it in the back room, which increases cost. And then you've got that out-of-pocket expenditure from that member. Average costs, talked about it, $9,000 in out-of-pocket expense that I have as a member. The average human, according to the last Federal Reserve report, doesn't have $400 in the bank. So you've got, it takes longer. The person paying the bill probably can't pay it all at once, if ever. So there's default rates, there's time value of money, and then the administrative process. So when it's really interesting when I talk to hospital CFOs, they love this conversation, right? Because it's math.
Right.
And I think the thing that I love the most about it, and again, call me Pollyanna, the member got that thing for free.
Right.
For free, $9,000 to the average. I mean, you and I probably make more than an average person, but $9,000. I just got back from vacation. I didn't spend close to $9,000. So I would love to take 2 more vacations a year and get my knee surgery done at a better quality place. I mean, duh. And if all I had to do was search on the site, it seems like a no-brainer. There's a skeptic out there that's saying Dean and Lester are cherry picking either types of services, geographies, or, we're cherry picking. What percentages of number of services, and we'll take those in 2 conversations, transactions, number of them, and then dollar amounts, fall applicable to location matters, right? Are we talking about a high percentage, a low percentage, what it is? And then second, is this in every geography, oh, I am in Chicago right now. There's tons of healthcare competition drives down price. But if you're in smaller market, you're in Kansas, smaller market Kansas, there's only a 1 hospital, 2 hospital town. Talk to me about those two things. If for that skeptic out there, let's go ahead and punch that person in the face.
Yeah. No, great question. So, I mean, let's be clear. We're not talking about emergency medicine here.
Let's
right?
throw those out there. We're not even talking about that. So
right.
10% of healthcare, throw it over here. Don't even talk about it.
Right. But the problem is a lot of people, when you think about healthcare, that's immediately where their mind goes. They have this idea that, everything's an emergency. And the reality is that's less than 5% of healthcare interactions are truly emergent. Now, there's some things that fall in the category of urgent, like, hey, I got a bee sting. I'm starting to swell up. I need a EpiPen. I don't have one. Okay, that's urgent and bordering on emergent, but you could probably go to an urgent care facility, i.e. not an emergency room, and for a couple $100 get your EpiPen shot and be as good as new. So emergency medicine is not what we're talking about, but the reminder here for everybody is that is a minuscule amount of healthcare interactions in the US. And by the way, it also kind of checks the box on where is all the high cost, right? I mean, that NICU baby that's born, extremely premature, well, that kind of fits in the emergency camp. And are there a lot of costs associated with that? Absolutely. Are we solving that one today? No, we are not. But again, let's get focused on the 95+% of healthcare that is not emergent, that is scheduled, and that can be shopped for in advance. And to talk a little bit about kind of the rural thing, I'm sitting in the middle of Kansas, a very rural part of the country, generally speaking, and there's all kinds of surveys on this, that if you give people the opportunity to save money on their healthcare, they will drive, they will travel. I mean, I'll speak for myself. You give me an opportunity to save $500 on a service, or $1,000 or several $1,000, yeah, I'll get in the car and I'll drive an hour, I'll drive 2 hours, I'll go where the savings are. I do it all I mean,
they do that for the nice mall. They do that for the Tay-Tay concert, right? They do that to go see the Shockers or the Wildcats, or
to get to the bigger airport to save $200 on the flight. I mean, we all do it. You're
Absolutely. Exactly correct. So it works in the rural, it works in the urban. We talked about the throw emergent over there, but out of the non-emergent, that 90% of the pie, what are we talking about here? Are we talking about a high percentage of that extra 90%, or what are we talking about?
Well, great question. And there's some different philosophies on this. A lot of, direct contracting programs and platforms are very focused on the high cost procedures, right? We're talking about joint replacements, bariatric surgery, cardiac services, spinal, neurology services, or neurological surgeries. That's a fine strategy, right? Those are high cost surgeries and services. A little bit of the challenge there is they're generally speaking low volume. There's just not a lot of them inside any one patient population on an annual basis. So that's not me arguing against those programs. It's just there's not as many of those procedures, so the opportunities to save money just aren't as great. Now, on the other end of the scale, there's lots of high volume but low cost procedures. Take imaging as a primary example, and back to my prior example. I mean, there's all kinds of opportunity to save $200, $300, $400, $500 on imaging just by shopping smarter. And most plans, even with a couple hundred employees, there's a lot of imaging sitting inside that plan. Well, if you could save on average $200-$300 on all those images, we did an analysis for the local school district. They had about 1,000 images in a plan year, and spent on average $1,000 per image. Well, our average cost per image is below $500. So $500 of savings times 1,000 images, there's just $500,000 of savings sitting just in imaging. And so our platform has been built to kind of cover the waterfront. We want to work all the way from helping people save money on a $40 lab all the way up to the, $30,000 spinal fusion surgery and everything in between.
Which when, again, go back to your CFO seat, I mean, you're throwing a party when you negotiate, a 39-cent reduction for ream of paper, or, you're not allowing salespeople to travel in the fourth quarter because you're trying to save on expense. And we're talking about such a higher cost basis that most organizations, like we've talked about, kind of are a little hands off or think that there's nothing they can do. So, Dean, being that you've got such a great experience on each side of this, you have been a consumer, you've been an advisor to personal people, you've been an advisor to employers, you've sat on the CFO side, now you run a business that maximizes this. Let's leave my audience with, if you're them, and what is that thing that they need to do that is going to have them have the aha moment? And I remember for me, it was truly understanding with my own knee procedure that got billed at $90,000. The plan picks up 45, but 1.2 miles away from the hospital was the orthopedic surgery center that'll do it for 22,000. Like you said, I spent 7,000 in my out-of-pocket max, 1.2 miles away, better quality. Like, until I saw it on my own deal, that was my, okay, I need to go do this every day. What's that one thing that you would say, hey, you're listening to this, you're somewhat intrigued, go do this, go ask this question. And if the answer, or when the answer is this, then you need to believe what Lester and Dean have been talking about. What's that one thing you tell people to go do?
Well, I'm a big believer in running experiments because, I always say, look, I can justify about anything if I put the label experiment on it, because a lot of people are, I think, afraid to commit to all kinds of things because they, it feels like they're donating a kidney, making a lifelong decision, an irreversible decision. And the reality is, most of what we're talking about in the healthcare space in terms of, switching out vendors, trying new strategies, experimenting in this area or that area, they all can be run as experiments. And so I just encourage people, because change is necessary here. There is no question about it, right? If we're going to keep doing things the same way, we're going to keep getting the same results, double-digit cost increases. And again, what people forget is those cost increases compound. So it's getting very expensive, is already, and going to become more so. Change is necessary, but a lot of people struggle with change. I'll admit the same for myself at times. We all don't like change, but it's necessary. And one of the ways to help drive change inside your health benefit plan is call it an experiment. Like, run some work with your advisor. Advisors, independent and innovative advisors are critically important in this space, but work with an advisor that hopefully is independent and innovative, and just try some things. Just experiment. Call it an experiment and run an experiment, and you will be convinced. Things like DPC and transparent PBM, and all the strategies that you're significantly more familiar with and aware of, and other advisors as well, that they really do work. I mean, they really do work. The case studies are out there. It's been proven, but a lot of people are they're hesitant, and change is a tough thing to do. So my advice would be, at least try some experiments.
Love it. Dean, if somebody says, man, he's got this platform that allows me to kind of understand this, I want to see more, or man, I got to get a hold of another CFO says, this guy sat in my seat, I want to chat with him. Where can somebody get in contact with you, follow you, understand more about your platform?
Yeah, probably the easiest way is just drop me a line at my email, dean@fairmarkethealth.com.
And the website for your platform
is www.fairmarkethealth.com.
Awesome. Well, Dean, if you don't mind, we're going to make sure that the website is in the show notes.
Great.
We might even give somebody a little tutorial about like how to make sure they understand this, because until you start to see the data, maybe this doesn't come to life, but, being able to have a place that they can see the data obviously makes this, drastically come to life. Dean, thank you thanks for you being able to change and leaving that safe corporate job and going into this behemoth of those of us that are holding hands to try to change this are a hair on an elephant's rear end, but we're going to keep making some strides. And again, the greatest part about it is being able to meet people like you, number one, and number two is we get to impact lives every day, right? Mm-hmm. And I think that's just, for me, that the thing that fires me up every single day is being able to do that. So thank you for your time. Thank you for your effort. Thanks for being a change agent. And we appreciate you being a guest here on Impact Healthcare.
Thank you so much, Lester. Appreciate you as well.
All right, to my audience, make sure you download this. If you're an advisor out there, you need to send this to every single client that you have and prospect you have. They need to hear it from somebody who has sat in their shoes. If you are somebody on that side of the desk, take Dean on his experiment. Do something. The definition of insanity is continuing to do the same thing and expecting different results. And I would say that our industry is pretty insane. So let's change that. Let's go out there and do exactly what this podcast is all intended to do, which is to impact healthcare. Dean, thanks so much, man. We'll see you soon.
Appreciate you, Lester.
You've been listening to Impact Healthcare, people and strategies that are disrupting the health benefits industry with Lester Morales. Remember, the journey to getting 20% savings on your healthcare benefits starts with total transparency. Remember to subscribe to the Impact Healthcare podcast on iTunes or wherever you get your podcasts.